are you doing? Lisa Howell here from Perfect Form Physio, and I'm here with Alex today, and we're going to show you a taping technique for the front of the ankle. Now sometimes you can have too much of a good thing, and a lot of dancers with a lot of point range can find that they can get irritated through the front of the ankle when they're doing a lot of work on point. And unfortunately this often happens right before you're about to do a show or an exam or something like that when you've been upping the hours of dancing. So I want to show you a simple taping technique that can actually stop you from pushing into your full range to allow this to heal while you're still dancing. So obviously if we are getting an inflammation we do want to back off, but sometimes that can be a little bit difficult, so this can help you rehab the front of the ankle until you have enough strength to control your foot yourself. So if Alex just pops up into standing and we have a little look at the foot on point. If you have a lot of range through the front, or if you've been dancing in a very soft shoe, often the ligaments and all the fascia through the front can get a little bit irritated. So we're going to actually do a taping technique that will actually bring her back to align her a little bit more so that she has more control when she's dancing on point. Just pop down into sitting. Now to do this I'm going to use two different types of tape, and the first one is what we call Fix-A-Mole. This is a very thin white flexible tape and it's very hypoallergenic. This just makes a really nice base to put underneath the more rigid tape. You don't need to put it on too tightly, it's just more of a base layer to really help protect the skin and to make a firm underwrap. The first thing we want to do is actually make an anchor around the ankle. So we take the tape around and cut off. Now this one has a paper backing, so I just peel off one side and then off the other. And you'll notice if the tape tends to curl around on itself, I actually stick it down to the table to stop it re-sticking to itself. When we put the anchor around the ankle, just flex your foot, because when the foot is flexed, the ankle is at its widest. If I put it around when Alex has her foot pointed, then when she tries to go onto a fondue, it'll feel really tight around the ankle. So we start with that anchor. Then we take the tape again, and I'm going to come underneath the arch and make a cross over the front, but with her back off her full point range. So I place this underneath. Measure out how much I need. And again, take the paper backing off. And place this underneath the foot. Now we want to make sure that we've got really nice alignment, and place the foot down in this position so it's half pointed but not pointed through to full range. I then bring this tape up and over the front, and then the same with the other side. And then we want to do the same thing with the brown tape. So the brown tape comes in a few different widths. I actually quite like to use this one, which is 25mm wide, so I can do a couple of strips for this particular taping. So we unwrap, and there are also lots of different types of this. Both of these tapes you can get on the Ballet Blog shopping cart. And again, we'll place this underneath the foot and up across the front, and this one we pull reasonably firmly. Then repeat with the other side. And then I'll do that a couple more times. And each time I'll cross it over by 2/3. and across. And sometimes the tape will stick to itself. So you can see here I've closed it over 2/3, so we're just making our way back across the front of the ankle. And pop it under. Good. And going quite firmly across the front. It also helps give a nice little lift to the arch as well. Now, especially if you have any allergies to elastoplast or anything like that, make sure that this white tape is still visible. There's occasionally something in the adhesive on the brown tape that some people are allergic to. However, the white tape is very hypoallergenic, so this helps stop getting any irritations or rashes. If you are taping the feet, if you have any itching or irritation at all, you must take the tape off straight away. Then we want to put a cap around the tops again. Now, I always recommend that you don't put the brown tape around the ankle. It doesn't have very much stretch in it lengthways, and this can really cut off the circulation down into the feet. So simply place over and flex the foot. And that just keeps all of those ends in nice and neatly. So then if we pop the point shoe back on again, and she comes up into standing, when we place on point, this will actually help hold up through the front of the ankle to stop her being able to push too far over on it. And this can really help if you do have very mobile arches and you're starting on point, or if you're a more advanced dancer and you've been doing a lot of training and it is been getting a little bit irritated through the front. This can really help keep you feeling supported in your shoe so you don't feel like you're about to fall out the other side. Other things to think of when you're doing this is to make sure that the shoe isn't too soft, and that's why you're falling out. Also make sure that your ribbon is placed so that it is supporting over the front. Some people have them too far forward and some people have it too far back. So you can play with the placement of the ribbons to help support through the front a little more. And some people with very mobile arches also find that they might like to add a vamp elastic, which is about 2 inches wide, about 5 centimetres, and actually stick it inside the shoe here and over the front part of the foot to stop the foot from really popping out of the front of the shoe. So if you've had any issues through the front of the foot on point, give this taping a try, see how it feels. You can wean yourself off it as you get stronger and as the pain decreases, but it is a nice way to help you get back on your shoes a little bit quicker.